Hello guys, it's Dr. Bryan Voithofer. What I want to explain to you today is I want to show you a little bit about what is chiropractic. For those out there who have never experienced chiropractic, or maybe you've been to a chiropractor but your chiropractor never really explained what it really is. And I also want to explain a little bit about how can it help you. Maybe you're dealing with some issues. Most people come to chiropractors for neck pain and back pain, but I also want to show you why there's a lot of people coming for really preventative care to maintain the integrity of the spine and optimize your nervous system, of taking care of all the single cells, tissues in your entire body. And I'm going to show you how that happens. So first, what is chiropractic? Chiropractic works with the neuromuscular system. So nerve, muscle, and joints. You can't separate those. If you move a joint, you're moving a muscle. If you move a muscle, you're firing a nerve. Okay, so those are all interconnected. So it works with a lot of your structure of your body. And remember, your structure is related to how well you function and heal. If you're like this, you're not going to probably heal as well. If your head's forward like this, you're probably not going to heal as well. Okay, so not only does it work with the structure, but it also works with, again, optimizing your nervous system. So I'm going to teach you and show you what that means. Here's some basic anatomy that we need to understand first. So this is really simple stuff. Number one, God blessed you and gave you this amazing musculoskeletal system right here. So this is basically just looking at the skeletal system and some nerves. But this, you have one of these. This is a plastic model. This isn't real, but it's just phenomenal when you look at this and how amazing it is. So the first thing you need to know is, what is your nervous system? I keep talking about optimizing your nervous system. Your nervous system is comprised of the brain that sits up here. That's your central nervous system. It'll send a message down the spinal cord, which travels inside here. And then the nerves, what they do is they come out and they go to every single cell, tissue, and organ in your body, muscle and organs. So just look at this diagram here. So what you need to know about this diagram is your brain has to send a signal down the spinal cord right here and out these yellow nerves to every single cell, tissue, and organ. So it's going to your heart, it goes to your lungs, it's going to your stomach, it's going to your liver, it's going to your small intestines, your large intestines, your kidney, your bladder, your sex organs, everything. These nerves are going out and they're feeding messages of functioning and healing out to the body. So now you got to remember, this is traveling at rates of hundreds of miles an hour. Messages from the organ, in the nerve, up the spinal cord to the brain, and from the brain down the spinal cord, out the nerve to these vital organs. Like, we know that this system is so vital, it is so important that literally it has protection. Right? Your brain is protected by a nice thick skull, and the nerves in here are protected by this spinal column. So you have this, it surrounds and protects that most important system. So like, you have 24 movable vertebrae from the top all the way down to the bottom. Movable, that's important. Not stuck, not out of alignment, but movable. These discs, and everyone's heard of degenerative disc disease or herniations and things like that. But these discs in between here, they separate it and they act as like cushion, right? So it's like sort of like a pillow. So we know that number one, this spinal column here is to protect this nervous system. It's so important. Number two, it's for movement, right? So you can move frontwards and backwards and turn and rotate, move your neck. You can do all these different things with your back and spine. Okay, those are all good. Now, what does a chiropractor look for and assess? So I'm going to show you now what chiropractic is doing, or what we are assessing when you come in for an exam. Because most people come in for neck pain and stiffness and things like that. Well, what we're looking for is we look for what we call misalignments. You know, you ever walk around and feel like you're sort of twisted or you're out of alignment, or you bend over and you hurt your back, or you might sit at a desk for a long period of time and you start to fall out of alignment when you're like this, right? That's called anterior head carriage syndrome. So like, this isn't good, that's not good. And when these vertebrae shift and twist, now they don't twist out of alignment like that, a severe change. That's macro, like trauma basically. But they can get shifted out of alignment, micro we call this, a small shift, doesn't take much. What that causes is a cascade of inflammation in the area of the joints. Now, that cascade of inflammation affects all the soft tissue around it, so it affects the nerve. So the nerve might be irritated. We can call that a pinched nerve, or you might get numbness and tingling going down your hands. We might have muscles start to get inflamed a little, so you get heat, redness, a little bit of edema in that area, swelling, or muscle stiffness. Pain is the biggest thing indicator, right? So we get a lot of pain in that area. The disc, here's the big thing is, if this properly is out of alignment, if it's not properly, but if it's out of alignment, like I'm saying, twisted just a little bit, you start to affect the joints. These joints start to degenerate, decay, because they're not being, mechanically, they're not moving like they should be, which brings nourishment to your disc. Okay, so that's not good. It's an unhealthy thing, and it's called a subluxation complex because it's affecting all the soft tissue in the surrounding area. Okay, so that's what I would do is I would look for your spine from the top to bottom, and I would assess for subluxation for these areas that are twisted or out of alignment. And what I do is we work with my hands to realign these areas. Really, I like to tell people it's back in alignment, but it's really to put motion and mobility back into the joint, right? When I adjust you, and you might feel a little pop or crack, that's normal. There's nothing wrong with that. It's just a joint capsule sort of opening up, releasing gas. It's healthy, it's fine, but it puts mobility and it like breaks that stickiness of being out of alignment and puts you back in, and it sort of realigns your body so then you can feel better, you function better. So now hopefully you can understand why I see people with neck pain, back pain, stiffness, sciatic issues, pinched nerves, degenerative disc disease, herniations, bulging disc. And you can see now how the health of your spine is directly related to the health and function of your overall body, cells, and organs. Now again, this is a piece of the puzzle. This isn't everything. That's why I teach about you have to eat well, move well, think well, and pray well in order to, all at the same time, it's as hard, but all at the same time for a period of time in order to see experiences of health. This is a piece of the puzzle. Movement of your back and spine, exercise, it's a piece of the puzzle. But if this spine starts to degenerate and decay and rot, your body's going to degenerate, decay, and rot. You're going to have pinched nerves, and these nerves can affect different parts of your body and your organs, and then the organs are at dis-ease, not functioning properly. Okay, so that's why if you have a back and spine, you should get an assessment. So if you guys need any questions or anything, please comment below. I'd love to answer your questions. Take care of the temple. This is Dr. Bryan. I'm praying for you guys all.